Our guest today is Dr. Nitigna Desai. She is psychiatrist at Veterans Affairs Department, and she specializes in addiction. Today we are going to talk to her not only about addiction, which is her expertise, but also in general about various psychiatric issues, including depression. Nitigna, welcome to our studio.
Hello.
And thank you for your time. And
Thank you for inviting me.
Sure, and we are looking forward to listening to you at the Health Expo.
Sure.
You will be a speaker there as well.
Yes.
So let us first start right away on the issue of depression. And it is still a taboo in our community, especially the Indian American and South Asian community. People don't talk about that. So if you can give us maybe 2 or 3 or 4 initial symptoms, that what are the symptoms of depression?
Sure. Yes, you are right. Depression is a very common psychiatric disorder. It's very common in Western culture as well as in Indian community. And I think some of the data indicate that 1 in every 10th Indian has depression.
1 in 10?
1 in 10. So it's very common. WHO at one point actually said India is the most depressed country.
Really?
So it's very interesting. And
but how come we never hear in our community, or we go to get-togethers and events and parties, nobody talks about it?
So as you said, psychiatric illnesses in general are still a taboo. People are not forthcoming. Many times the symptoms are ignored. So let me go over what the common symptoms are that people may learn from and pay attention to. One of the important symptoms of depression is that feeling sad, anxious, or empty. That's number 1. Many times they feel irritable and they don't know why. It also oftentimes is described as feeling lack of energy, not feeling like doing anything, not having fun in any activities that they normally enjoy. Many times they also feel there's nothing to look forward to, so they're hopeless or helpless. They also feel guilty about something that they don't even know what they're feeling guilty for. Oftentimes it also results into lack of appetite or eating too much or sleeping less or sleeping too much. Many times it can manifest as vague aches and pains that just doesn't go away with any normal treatment. So it can have many different presentations.
Is there any difference in these symptoms between children and adults?
Sure. So usually, the general impression is that when you're depressed, you look depressed, and that's not true. For people who are higher functioning, particularly adults, any deterioration in your level of functioning is an indication that there may be some psychological issue. For kids, oftentimes it's manifested by behavior, that either they're irritable, cranky, defiant, not interested in their schoolwork. So with kids, it's more behavior rather than the feeling, because kids are not going to express their feelings as easily.
So I'm going to pick on one thing you mentioned earlier, sadness. Now, there are so many causes of sadness, but how do we identify which sadness is because of depression or which sadness is real sadness? Is there any?
So, in general, if you have an incident that happened in your life, that's a normal grief. And usually the duration of symptoms is important. So if someone's feeling sad, or if they have all of these symptoms, but they are there for less than 2 weeks, then it doesn't really count as depression. So this another important word here is persistent symptoms, and they have to be present. And you have psychiatrists usually have a way to make a diagnosis that you have to have certain number of symptoms present for at least 2 weeks. And they don't go away in any 6 months period. If someone has a loss in the family, if you lost a near close family member, you are going to feel sad. You're going to have some feelings. However, most of the time people are able to resolve that any times between 2 to 6 months. When these feelings do not resolve, even if started with an incidence, after 6 months you need to get psychiatric help.
So what type of, like, is this medication or basically counseling?
So oftentimes we make a distinction between depression or is it a major depression. And depending upon the intensity and the severity of symptoms, we decide uncomplicated simple depression can improve with counseling, with what we call psychotherapy. But if it doesn't resolve with a couple of sessions, then most of the psychiatrists will recommend a medication.
Now, again, talking about medication, I see in the news and hear often, in the newspapers and all, is that there are some specific medications which are given to children who are hyperactive and all this stuff.
Sure.
Right. So what is the implication of those medications, and what type of symptoms are those in children?
Sure. Now you're talking about attention deficit.
Exactly.
Sure.
Yes, yes.
So commonly known as ADD or ADHD. So attention deficit, again, there are various types of ADD. One is predominantly inattentiveness. Second one is hyperactivity, and third one is combination of both. So in kids, oftentimes you see the inattentiveness, but also some impulsivity and hyperactivity. So what I mean by inattentiveness is that if you give them something to do, they're never able to follow your instruction. They get easily distracted. Many times the parents complain, he doesn't listen to me or she doesn't listen to me. Or what I'm saying only lasts for a few seconds, and then sometimes people view that as forgetfulness, but oftentimes that forgetfulness is the result of inattentiveness. The hyperactivity part, sometimes you see in kids that they can't sit still. They are active on the go all the time. And oftentimes you see kids who are very impulsive, that they, particularly in the school, they can't wait their turn. They blurt out the answer even before the question's finished. So those are the symptoms of ADD or ADHD.
Okay.
In general, it can continue during the adulthood, but you have to have the symptoms, the onset of the symptoms has to be before age 12 in order to make it a diagnosis of ADD.
Okay. Now, my question...
The medications.
The medications.
Right, right. So there are medications, and some of the medications are known as stimulants, and they're commonly prescribed to the kids because of this inattentiveness. Their school grades are suffering. They can't sit through the exam for a long period of time because they have to pay attention. They usually avoid activity where they have to pay attention. So the stimulants help them pay attention. However, what we know so far is the stimulants also can be addictive. What we do know that it doesn't really have any impact on the growth or the brain development in long run. But most of the time, if they are given to the adults, a lot of adults actually abuse them. And what we know is when it's given properly and when it's given to the child who really needs it, we do not see them abusing it or having dependency as an adult.
What about, does this type of problem exist in adults too?
It does. It does. So as you get older, as I said, the onset might be as a child, but you can have it as an adult. But usually you don't have a new attention deficit as an adult. So if you didn't have it before the age of 12, what you might have in attentiveness might be something else.
Okay.
It's not attention deficit.
Okay. Now, coming back to addiction,
Mhm.
which is your expertise,
Sure.
so tell us different type of addictions.
So as we know, I mean, the addiction is a broad term. There are
Okay.
lots of substances that people can get dependent to. And now the term that's commonly used is called substance use disorder. But addiction covers, besides the substance use disorder, also food addiction, gambling addiction.
So you can also get addicted to food too?
Food too.
Okay.
Food too. Gambling, and now the newest, the latest is the internet addiction.
Yeah, I was going to talk to you about that,
Right.
especially because we have come across a lot of studies where
Sure.
it is said that Facebook addiction or social media addiction
Sure.
is as dangerous or as intense as addiction to heroin.
Well, that's what we hear. I don't think we have good evidence-based literature. It's a new phenomenon. And people are meeting the criteria for addictive behavior. But again, yet, we really need little more literature to see, what it, and then yes, you are right, that we do hear here and there, and we have some articles or newspaper off and on talks about it. So in general, when you call something an addiction, that people spend a lot of time doing one particular activity. Either they are involved with the activity, looking for that activity, preparing for that activity, or when you are not doing that particular activity, they kind of feel restless, or they feel anxious, or they feel urges or impulses to go back to doing the same thing.
So the common addictions which we hear is, of course, addiction to alcohol,
Sure.
addiction to drugs, cigarettes, and of course now social media is coming up in that. So if I ask you to, you give an idea that what addiction, how it is there any time frame, or is there any intensity which can be measured that if you meet this criteria, it means that you are addicted to whatever
True.
whatever you
True.
have?
True. No, that is actually for anybody to meet the criteria for substance use disorder or substance dependence. We have number of criteria. In order to call it a mild addiction, you need to meet at least 2 criteria.
Okay.
Moderate is 2 to 4 criteria, and anything more than 4 is severe. And there are number of criteria, total number of 11 criteria. So those criteria are that the person is spending excessive amount of time either using the substance, looking for the substance, or trying to make sure that they have the substance lined up. Then it has an impact on their social life, their occupational life. Someone who had DUI and continue to use alcohol. So things like that, that's one of the criteria.
Okay.
Oftentimes the criteria are, and it depends on the substance, that if they use the same amount of substance, they're not getting the same feeling. So they develop tolerance with what we call. And if they stop using that substance, they have withdrawal symptoms. But it changes from substance to substance. So alcohol has a very distinct withdrawal symptom.
So let's talk a little bit in more detail about alcohol addiction.
Sure.
So how the alcohol addiction is different than others, and what are the key, like drinking, it is first thing that is very socially acceptable.
Sure.
Many other like drugs and all, they are not socially acceptable. And alcohol, you can go to a party and still it is
Right.
acceptable.
Right.
So how do you really differentiate that, this is going beyond the limit and one should see physician or...
So in general, the National Institute of Health has a guideline. What is an acceptable limit of drinking? So for a man, for a healthy man, no more than 3 drinks in one sitting or one day, but no more than 14 per week. If they exceed that amount, regularly,
Mm.
then it's an indication that there might be a problem.
Mm.
For a woman, no more than 1 drink per day,
Mm.
no more than 7 in a week.
Mhm.
Otherwise, it's an indication that they might have a problem.
Mhm.
So that's one way to look at it. If we have to make a diagnosis, again, as I said, you have to meet certain criteria. So most very simple way to make a diagnosis is, the doctor will ask you, have you tried to cut down the amount of drinking?
Mhm.
Have you ever felt annoyed when someone made a comment about your drinking?
Mm.
Do you ever feel guilty about your
Yeah,
drinking?
that I've never heard that. If somebody makes a comment, it can be indicator.
So if someone gets annoyed or defensive,
Right.
it kind of is an indicator. It's a most of the physicians would know. It's known as CAGE criteria, CAGE,
Okay.
that you try to cut down, you felt annoyed, you feel guilty, or do you ever use alcohol as an eye opener? Like
So
first thing
that's
in the
where
morning.
the cage comes, right?
Yeah,
Okay.
yeah,
Okay.
yeah. So it's a very simple way to make a diagnosis.
Mhm.
But then if you want to make a more sophisticated diagnosis, then as I said, we have 11 criteria to choose from.
Mhm.
And then most of the time people with alcohol use disorder will say that, well, I tried many times to try to cut down and I can't. Or I need more than what I used to drink to feel the same way. Or I can now handle more drinking. Sometimes people have this myth that if I don't get intoxicated, it's not a problem. Actually, interestingly, people who don't get intoxicated actually are likely to have a higher risk of being dependent on alcohol.
So why is that? Like, is there?
So because since they don't get intoxicated, they think they can handle and they keep drinking. So they do get to a point where they are exceeding the limits. And
So why? Because they want to get high and they're not getting high, or?
so many of the alcoholic, they will tell you that yes, they wanna get high, they wanna feel sometimes people say buzz,
Mhm.
and they used to feel that with 1 drink, and now they need 2, and now they need 3 or 4. So that's how they develop the tolerance. If they stop drinking, then they have very distinct withdrawal symptoms. So they don't like that. And then sometimes you will also hear from people that they only drank in the evening, but now they need a little drink in the morning so that they don't feel the hangover or the withdrawal. And that's actually an indication of progression of the illness.
So if you can explain a little bit about withdrawal, how the withdrawal feeling is.
So, so most people actually can describe it clearly, but for medical people, what we look for is what we call autonomic instability. So you have high pulse rate, high blood pressure,
Mhm.
you're breathing a little faster. So that's the physiological sign. But then they will say, I have headache, I have nausea, I don't feel good. Many times it can progress. So most people, if they drink regularly, from the time they stop drinking, in about 6 to 8 hours, they will have some of the symptoms. But it can progress to a point that they may have withdrawal seizures,
Mhm.
or they might. I mean, not most people. I mean, it doesn't happen as commonly, but it can progress to something very, very, very complicated, which is life-threatening. That we call it delirium,
Mhm.
DTs,
Mhm.
and that's actually DTs is a fatal. It can be fatal.
So what is DT, if you can?
So delirium tremens is a condition where the person is hallucinating.
Mhm.
They're disoriented. They're confused. Along with their blood pressure, their pulse, their temperature, everything kind of is out of control.
Mhm.
And that condition, actually, the mortality is very high. About 15% of people, if they don't get treatment within time, they can die.
Now, in terms of if you go back to, I mean, we hear all the time. There's no need to go back, but we see all the time, we hear all the time that people were drinking and they stopped. They were totally normal for a couple of years,
Sure.
and then again go back, fall in the trap.
Yeah.
How common is that, and why that happens?
It's a good question. So in general, addiction is a chronic illness. So most people know that diabetes, you never get cured from diabetes. Asthma, you never get cured from asthma. But you can control it if you take your medicine, if you follow your diet, and if you see your doctor regularly. Similarly, addiction is a chronic illness. You can control it if you stick to the treatment. Once you deviate from that path, chances are that you may relapse again. Not necessarily everybody who is in recovery will relapse, but in general what we know is 30% of the people within 30 days will relapse.
Only 30 days?
Within 30 days. Additional 30% will relapse within 3 months. So it's very, very difficult to get to the total abstinence if you have a true disorder.
Okay. And if you are not getting the treatment?
If you're not getting the treatment.
If you're getting a treatment, chances are that
chances are it's completely, yes, you can completely control it and have a normal life.
Okay. Now, other major addiction, which is also socially, well, now it is no longer accepted, but socially still, you can go out of party and smoke a cigarette. That's acceptable.
So tobacco addiction is still a killer. I think, and it's one of the toughest addiction to quit actually. Tougher than alcohol. Tougher than alcohol. The reason being, in general, what we know is any substance that gets to your pleasure center in your brain, faster it gets there, the more difficult the addiction is. And tobacco, since it's smoked and inhaled, it gets to your pleasure center in the brain very quickly, within seconds. So it's one of the toughest addiction to quit.
Yeah. Can you talk about any funny addiction, like which is crazy that you came across something and oh my God, this is
Funny addiction.
Yes.
So gambling is one. I mean, it's not funny.
It's not funny.
It's not funny. It's a serious issue.
Yeah.
But as you said, internet addiction for now, I think is perceived as funny, but I think it is a real thing. I think at one point, people used to also have, they keep playing the games on the computer. And I think what we think so far is you have a genetic predisposition to certain things. And addiction, certainly, most people who will have addiction, it has multiple factors. One is your genetic predisposition, but also biological. So sometimes you have chemical imbalance, and it can be the chemical imbalance that leads to addiction, or addiction can cause the chemical imbalance. So it's kind of vice versa.
What about emotions?
So emotion actually can also, and many times, that's a very good question, because many times people with depression or anxiety, they kind of use substances as a kind of self-medicating, because they feel when they go to party, they're anxious. But if they have a drink or two, they can socialize better. So then they become dependent on that reward.
To socialize.
And then then it becomes an addiction, because by nature alcohol is addictive. So then they initially start out for an emotional issue, but then it becomes an issue itself.
Yeah. Now, one addiction I had never heard of, and you mentioned, was a food addiction. That I'm really first time I'm hearing that somebody can get addicted to food.
Food addiction is also another
so
very interesting.
So give me an example, like how it happens and.
So again, food addiction. Many people will say, well, I'm addicted to food, but then the psychiatrist will know how to differentiate. Is it just addiction, or is it eating disorder? Because people with eating disorder, they can have anorexia, where they don't want. They actually, it's not. People in general think that anorectic don't eat. They eat, but they don't like the weight gain. So what they then there is a type of eating disorder where it's called bulimia, that they eat too much and then they purge, meaning they go out and vomit, or they take laxative to kind of get rid of everything that they had. And so food addiction can also progress to eating disorder.
Now, is there any study, or have you come across anything, these addiction issues in the Indian and South Asian community?
So again, I don't. Yes, it is a real thing. I mean, you probably have seen it. We see it all the time.
I was surprised actually. Just now you mentioned that 1 in 10, according to World Health Organization.
For depression.
For depression, that is too much.
It's a.
And so, is there something number like that exists for the addiction?
So far, I don't think I can quote the number. And in general, I think the Indian society, I think the way we function in India, and then another thing that I was going to mention, that addiction, besides the genetic, the biological, also the environment and the exposure plays a big role. So growing up in India was different. Growing up in Western countries is different. So I think the second generation Indian kids who are growing up in Western countries, they are at a risk as high as any other Americans. So I don't think that we have any immunity. We may have a little bit of a better support network, and we may have less genetic predisposition, but it can continue to change.
Now, so if we have to watch, say, you were talking about the younger generation,
Sure.
What are the symptoms we should really look for in the kids, like, who are teenagers and all that? You know what, if I notice this thing in children, we should have a talk with them. What are the 2 or 3 things we should look for?
So if you're asking me what should we look for in kids who might have addiction?
Yes, because many times, parents live in delusion. They say, no, my kid can never do this.
Sure.
And
So, I mean, one thing, let me clarify. I mean, most of the kids who go to school in this country, they have education. You know about DARE, right?
DARE, yes.
In junior high, they get some education, some exposure. You would hope that you prolong the exposure to any addictive substance as late as you can, because earlier the exposure, more higher the risk. So that is the goal of the education. So as a parent, you do want to educate your children that what is addiction, what can it do to you, what happens to people who are addicted, how difficult it is to quit something once you get addicted to it. So that's one thing. What to look for in a kid who might be using substances, it all depends on what substance. However, sneaky behavior, being secretive, staying out without good explanation, or many times you can tell by who they are hanging out with. And of course, if they are smoking tobacco, you would
there
know.
you can smell, yes.
If they are getting intoxicated with alcohol, you would know. If they are using other substances which are not as obvious, it's going to be a little tricky. And I think the only way the parents will know is keep the communication channel open with your children. Try to get involved with them as much as you can. Try to know who their friends are, who they are hanging out with, what are they doing in their free time, how are their grades. Another very good indicator is if your kid was always a bright kid, maintained A's and B's, and now the grades are dropping. One of the things you want to suspect is there anything that's influencing my kid?
That's right, okay. Now, is there any particular age which is much more vulnerable for addiction?
So adolescent.
Adolescent.
Adolescent is very vulnerable.
Which will be like
adolescent is the teenage.
teenage.
Yeah. But as I said, I think the late the exposure, the less the risk. But college kids, when they are freshmen, they are most vulnerable because they are still kind of anxious to be friends with everybody. They want to impress other kids. They want to be, and then there's a lot of peer pressure, and they are not ready to say no. So that time is also very vulnerable.
Yeah. Any vulnerable age for depression?
So depression again, the most common onset of depression is between 18 to 25 age. But depression can happen any time of your life. It can happen as late as 70 years old and 75, and actually depression is one of the very common issue in elderly. So depression can happen any time of it, but the most common age of onset for a major persistent depressive disorder is 18 to 25.
Let us talk a little bit about depression in couples, married couples. Is it possible that both husband and wife can go through depression at the same time, or is it? Give us some insight about that.
So depression is not contagious.
Okay, no, of course I know that, but it may be like one partner is depressed, other can be drunk.
But it could be that they are depressed because of the social circumstances. And many times one of the technique, the psychotherapy technique we call is interpersonal psychotherapy. That their depression is perhaps related to interpersonal relationship. And if the psychotherapist can try to understand and also help the patient understand that what they are doing can be done differently, oftentimes you see the good results. So it could be the marital conflict, but it could be that both of you are going through some difficulty in life that both of you are experiencing at the same time. May it be occupational, demanding job, demanding kids, daily, multiple demands in your life, and that oftentimes, depending upon the intensity or how bad it is, can be dealt with individually or as a couple. We also provide couples therapy. But again, the psychiatrist has to determine, is it related to the interpersonal relationship, is it related to the marriage, or is it an individual thing?
How deadly is that? Have you come across like husband and wife both are going through that situation, and then you find that?
So oftentimes what we come across is, let's say, if a patient has addiction, and the communication between the husband and wife is not as good, or many times in the Indian society, what we do know is in Indian, and in general depression is a little more common in women, but in Indian women depression is very common, and the incidence can be as high as 70%.
70% depression among Indian women.
Indian women. And one of the speculation is that's because the way Indian society is. I mean, I'm not talking about Indian society in America, but the Indian society in India, oftentimes they live in a joint family. It's a male dominant society oftentimes. Women are not educated as well, and they're not able to express themselves, so they kind of internalize all their issues, which eventually results into a chemical imbalance and depression.
But we do bring that baggage here too with us.
We probably do,
Yeah,
you are right.
yeah.
And there are cross-cultural differences.
So, but if I ask you that maybe the first thing we grew up in that environment and we bring that baggage here, when we come here, our life becomes even much more complicated because again we are suddenly, you can call it withdrawal, not so many social activities, we are in different culture, we don't know many people, language, cultural, so many issues come. So the chances of that increasing here can be too, even in the...
Yeah. And I think, I don't have the data on Indians in America particularly, that if the incidence is same or is it different, because I don't think we have large-scale studies differentiating that. There are people who have been looking into it, but I don't think I have the actual number that let's say 70% of women in India might have depression. I don't know how many Indian women in America, but in general, the incidence of depression even in America
Among
is
women?
about 7%.
7%.
7%
Okay.
in general, like no man or women,
Okay.
and it's double in women than compared to men.
So 14% American women and 7%. Okay.
Correct.
But even compared to India, 70% is too high.
Women,
The
yeah.
women,
The
yeah.
general incidence is anywhere from 14 to 25%. So as it is, India has a lot of depression.
So Nitigna, one more question I want to ask you about anxiety. And how common is that? And also want to talk about American community versus the Indian community.
So anxiety disorders are often actually very common. Again, the incidence in general for general population is as close as 14%. So very common. Anxiety many times goes hand in hand with depression. But you can have independent anxiety disorders, and under the umbrella of anxiety disorders, you can have generalized anxiety disorder, where people are just, you might know them as a worrier, they worry about everything. But what clinically what we say is that they have persistent worry, some unknown fear, or often apprehensive about everything. So that's generalized.
So like somebody is totally fearful or scared of things which may not happen, but this is just in their
in their mind.
Okay.
Yeah.
So is it different than phobia, or we're talking about?
So phobia is a specific thing. So
Okay.
this is of unknown anxiety.
Okay.
Versus then you can have panic attacks. Panic attacks are a little severe form of anxiety where they actually break out in sweat, they feel like they're choking, they feel like the butterfly in the stomach, or they feel their heart is pounding. Their hands are often clammy and sweaty. So that's a little serious form of anxiety disorder. Then you can have OCD, which is obsessive compulsive disorder.
That I've heard, yes.
Where people have some intrusive thoughts in their mind, and they don't like it. So what they experience is anxiety, and as a result, they kind of turn to doing something which becomes almost repetitive, that they either psychologically or by their action, they keep doing things to undo what they are experiencing in their mind. And then you can have post-traumatic stress disorder, where you have had an exposure to some extremely traumatic event, and most people are able to kind of heal and move on within 2 to 6 months. But if this continues to become an issue, most people will say they have flashback. That during the daytime, they're constantly rehearsing the same experience over and over again, or they have nightmares, that they have dreams about it and they wake up, or they are going to a very great extent to avoid a situation which reminds them of the similar event, or they become kind of hyper reactive. So if something like that happens, they kind of jump. So all of that can be a symptom of post-traumatic stress disorder. And then you can have specific phobia. Some people have phobia of speaking in public. It's called social phobia. But some people have fear of riding in an elevator, or going in an airplane, or being in a closed space, which is called agoraphobia. And then you can have phobia of snake, or some specific thing that you are so worried about that it's sometimes almost unreal, and that's called phobia.
So now, of course, the physician can treat them better, but just for a common person like us, what is the best cure? What should we do if we are going through that?
So anxiety disorder are very easily treated. They are very treatable. Again, you can have psychotherapy, and many times what we focus on is that the phobias or the anxiety is the result of your perception. So how your perception is negative and therefore your experience can be negative. Or sometimes what we do is exposure therapy, that you kind of expose them to the situation that's making them frightened little by little until they are desensitized. Or you can have cognitive behavioral therapy, where you kind of rationalize for the person and eventually they get better. But if the therapy doesn't work, there are medications, and the medications work very well.
Well, Nitigna, thank you very much for your time, and it's really fantastic talking to you. I learned so much.
I hope this,
Okay,
this
and
was
then we are
useful
looking forward to seeing you at the Health Expo.